Well, good morning, everyone. I'm Dr. Anastasia Horonis, clinical psychologist working in the field of addiction recovery. I do research into addictions and I also work clinically in the clinic helping people overcome addictions of all sorts, whether that be substance abuse, drug and alcohol, vaping, cigarettes, or behavioral addictions like gambling, online shopping, pornography, sex, etc. What I'd like to do today is take you through one of the daily reflections. Now, I know that for many of the clients that I work with who are involved in 12-step programs, they are very familiar with the process of daily reflections. And if you two are watching and you're familiar with daily reflections, then welcome. I'm a big fan of the concept of daily reflections and would also like to extend this concept to those who are perhaps in addiction recovery but not engaged in 12-step programs. And just to highlight the benefit of being able to spend, a few moments, a few minutes each day reflecting on recovery and where someone is at in their recovery, and particularly around a specific topic. I like that that's what these reflective passages provide. They provide a topic to reflect around rather than doing sort of bigger picture, broader reflection, which can often feel very overwhelming for a lot of people to just sort of stop and just kind of consider where they're at in their recovery process. So today is the 31st of March, and so I'm going to be reading from A Day at a Time, one of the daily reflection books for people who are in recovery. I'm not going to read the whole thing. I will read some parts of it and then share some of my thoughts with you as a practicing clinician as to how we can consider these concepts and put them into practice. So the reflection for the day. My illness is unlike most other illnesses in that denial that I am sick is a primary symptom that I am sick. Like other incurable illnesses, as diabetes and arthritis, however, my illness is characterized by relapses. In recovery, we call such relapses slips. One thing I know for certain is that I alone can cause myself to slip. Will I remember at all times that the thought precedes the action? Will I try to avoid stinking thinking? Today I will remember nobody is slip-proof. I really like that final part, nobody is slip-proof. And this is the part that I really want to speak to, that one of the most common risk factors I see when I see people in recovery who have had a period of recovery up is this sense of overconfidence that can come about. People can enter a state where they feel like they no longer need to put the protective measures in place, they no longer need to be vigilant. They can maybe move from a place of abstinence to just sort of having a little bit, but I kind of characterize it as this overconfidence that can come about. Now, of course, confidence in and of itself, there's nothing wrong with that. I encourage people to be confident in themselves, in their ability to make changes for themselves, and in their ability to recover. I'm all for that. But it's this overconfident piece that when it starts to creep in, I can really hear it in the therapy sessions. I can hear that there's sort of a change in the way that people are thinking about their recovery and relating to their recovery, and it can be a bit of a slippery slope and somewhat of a dangerous place for people to be. It's this overconfidence that can sometimes come hand in hand with the concept of denial, and that's why I think this passage is a really interesting one for today. Given that it's the end of March, just sort of spending a bit of time thinking about perhaps the holiday period that's coming up with Easter, if people are celebrating that. In Australia, we have school holidays coming up. We're reaching kind of a point in time in the year where people have been working and we're now taking some sort of break and holidays. And so it's at this point that I think it is useful and valuable to consider, am I potentially slipping into a place of overconfidence? And is that paired with a sense of denial, a sense of perhaps not being as aware of the risks that I might face, the risk of having a lapse or a relapse, or as a slip, as they call it. Am I perhaps not recognizing those risks as much as I need to be? So that's the daily reflection I'm going to leave you with today. That's my reflections as a psychologist, what I see in the clinic, this pattern of overconfidence that can come in. And so if you are going through the process of recovery, I wish you all the best. I hope this has been useful, and I hope you can spend a few moments today reflecting on overconfidence and the theme of denial in your life.